Story 1. I did not really have a warning sign. I just found a tumor on my testicle. Men, especially younger men, please check your testicles. Seriously, having a tumor is much better than being dead. Story 2. A friend of mine noticed a small lump in her breast. She was breastfeeding her infant, so she thought it was a clogged duct. A few months later, she had it checked when it did not go away. By then, it was stage 4. She did not survive. Story 3. For my grandmother, it was the sudden aggression from her dog. They took it to the veterinarians asking why it was suddenly growling at her all the time, and they told her to go to the doctors. Stage 1 bladder cancer. No symptoms at all. She made a full recovery, and we got another 11 years with her. I owed that dog everything. Story 4. I had Hodgkin's lymphoma as a teenager. I had no idea that relentless, extremely itchy legs at night could be a symptom of my type of cancer. I should have known something was wrong when I was bringing forks and pocket knives to my legs to ease the itch, and it still did not work. Thankfully, technology and science are great, and a previously fatal disease now has over a 90% cure rate for early-stage disease. 7 years cancer-free this year. I still deal with health-related anxiety and post-traumatic stress disorder. I do not feel safe in my body. Story 5. Just feeling blah and night sweats. It was July 1985 and I did not get it checked out until September 1985. I nearly died from advanced testicular cancer. It was a wild ride with 4 months of chemotherapy and a year of recuperation. Having a 40 years of being alive party in December this year. Story 6. My father had no symptoms. His condition was found by accident during a scan for something else. My husband had no symptoms. His condition was found by accident during a scan for something else. My mother-in-law and sister-in-law had no symptoms and underwent regular mammograms and screenings. My brother-in-law experienced bruising, bleeding gums, and joint pain. I had no symptoms and was diagnosed through a pap smear. Get your screenings, everyone. Story 7. Malaise. Felt unwell all the time, chronic lower back pain, fatigue, constipation, and a sense that something was wrong. My blood tests were normal and I did not have night sweats, no standard indicators for what I had. When I said something was wrong, doctors pointed to my normal blood tests and said that if something was wrong, it would show up there. It was stage 4 lymphoma when it was finally diagnosed. I am in remission almost 3 years. At my follow-ups, they review my blood tests and ask if I have night sweats. Story 8. That annoying cough that just won't go away. I have heard many stories of people getting fed up with a random cough that appeared suddenly and lingered for months. They finally go to the doctor to find out it is cancer, possibly even in an advanced stage. Story 9. My mother had lower back pain. She thought it was a result of a former injury. Turned out it was likely caused by cancer. Story 10. I worked in gynecologic oncology and handled all of our referrals. Ovarian cancer presents as abdominal pain, constipation, fatigue, and bloating. This is often overlooked by many physicians. Unfortunately, most patients are not diagnosed until stage 3 or 4 because there is no established guideline for screening. Postmenopausal bleeding should not be ignored. Most postmenopausal bleeding cases are due to endometrial cancer. Cervical cancer concerns me more than any other cancer I have seen. It usually presents as abnormal bleeding and pain during intercourse. It is also often overlooked. Please get your Papa Nicolau smears. I promise the treatment for cervical cancer is much more invasive than a Papa Nicolau smear. Unfortunately, my office saw many women in advanced stages of these 3 cancers because their symptoms were dismissed by many providers. Story 11. My mom had trouble with discharge from her nipple as well as inversion. The doctor said it was a rash. She got a mammogram anyway. They found 2 forms of breast cancer, infiltrating ductal carcinoma and Paget's disease. Later, she experienced severe back pain. The doctors were generally just treating the pain. I insisted on a scan to check for a kidney stone. Instead, they found cancer in her liver. It was Mother's Day. It appeared that the breast cancer, which we thought had been detected in time, had metastasized to her liver and, as we later discovered, her bones near the liver. She passed away a little over 3 months later. Story 12. I have no idea if this was a coincidence or not, but I have always had terrible spring allergies due to tree pollen, usually from early April to early May. The year I was diagnosed with breast cancer was the first and only time in my adult life that I had no allergy symptoms in the spring. I was diagnosed in early June. I always assumed it meant that my immune system found a real problem to deal with rather than overreacting to something non-threatening like trees. My allergies have absolutely returned, and I will be wary if I ever have that experience again. Story 13. My dear friend had breast cancer, underwent a mastectomy and radiation, and is doing well. A few years later, she began experiencing severe neck pain. Doctors sent her to physical therapy and a chiropractor, but no one connected the symptoms until she had a stroke. They then discovered a tumor that had spread to her neck and spine. Once you have had cancer, any new health symptoms should be evaluated with that history in mind. Story 14. Just to add a little brightness in a dark topic. My dad got up to urinate in the middle of the night and saw blood in his urine. He thought it was definitely weird but went back to bed. The next morning's urine release produced no blood or redness, and he thought it was no big deal and went to work. My dad is definitely one of those tough guys who only goes to the doctor if he has a limb hanging off. But he mentioned it a day later to my mom and me, and we made him go to the doctor. It was bladder cancer. Bladder cancer has over a 90% success rate if caught early, which it was. The doctor told us the only time that cancer is fatal is when people do the exact same thing as my dad. That is, see blood once and brush it off. He had to go through surgery and treatment and has been cancer-free for over 10 years. Story 15. Specific to all men. When your wife says you need to go get X checked. Source. Over 10 years in end-of-life care. Story 16. Swollen lymph nodes. My mom had them for almost 2 years before getting diagnosed. When she went to the primary care provider, they told her the nodes were just sticking out because she was skinny. Also, a cough that wouldn't go away. Coughing up blood, weight loss, all of this right before her diagnosis. There were unusual variations in blood counts, including high white blood cell count and low red blood cell count and hemoglobin, and high mean corpuscular volume. She had breast cancer in her bone marrow caught at stage 4. All of her mammograms were clear. She had a rare subtype called lobular carcinoma, which accounts for 10 to 15% of breast cancers. It isn't always seen on mammograms. Around 30% are not visible because of the single-file way the cancer cells grow. If you have dense breast tissue, getting an ultrasound or magnetic resonance imaging could be life-saving. She fought it for 4 years and was only 53 when she passed. I know she would want her story to help someone. Story 17. Unexpected weight loss seemed like a good thing at first but turned out to be a major red flag. I wish we had looked into it sooner. Story 18. My mom had a sore that just would not get better. I saw it when she was in the hospital after we found out she not only had cancer, but it was stage 4 and the end was coming fast. At first, I did not think anything of it until I went into her bedroom and saw all the stockpiles of bandages and patches. I asked her how long she had been dealing with the sore. It was under her armpit, so not visible to the rest of the world, and she said over a year. I feel like if she had gone in when she first noticed it not healing, she might have had a chance to fight it. Story 19. Any mole that changes at all should be checked. My sister was diagnosed with melanoma at 22 and died at 30, all because a mole was not checked and removed at the first sign. Melanoma is very treatable when caught early. It hurts, itches, bleeds, and more. Do not ignore any strange marks. Our family suffered greatly because we never thought this could happen. She left behind a 10-year-old and a 6-year-old whose lives were destroyed due to avoidance, fear, and ignorance. If this message helps even one person make that call to a dermatologist, it will be worth it. Story 20. I just wish that my loved one had received the recommended colon cancer screening when they turned 50 instead of skipping it and then ignoring severe symptoms until they finally had a scan, were diagnosed with stage 4 colon cancer, and died 4 months later. I also wish they had not trusted false medicine and unproven remedies over science and medicine. Maybe they would still be here. Preventive health screening saves lives. Story 21. Bizarrely enough, extreme fatigue is often an indicator of cancer. It is a massive difference between being up for 23 hours straight or being tired due to lack of nutrition. It is exhaustion that does not go away. Story 22. Fortunately, I did not wait until it was too late, and my doctor took it seriously. I had been experiencing intermittent pain when swallowing for about 6 weeks. It felt different from a sore throat, as if it was between the outside of my throat and the skin of my neck, rather than inside my throat. The doctor said the only options were to order an ultrasound and a mononucleosis culture. 2 weeks later, it was diagnosed as metastatic thyroid cancer. My only symptom was occasional mild pain, rated 1 out of 10, when swallowing large gulps of water. So it was not the severity of the pain, but the unusual nature of it. Fortunately, I am in remission now. Story 23. Reading these replies, I think we need a follow-up post. How to make a doctor do their job and listen when you say something is wrong. I have known many women who spent years suffering, trying to find a doctor who would listen before finally getting a diagnosis and medications that can help them. I have also had very concerning symptoms for at least 10 years now, but they are not visible symptoms, so I know they will be brushed off. It is frustrating to think, if I ever lose 50 pounds, I will go to the doctor. Maybe then they will listen. If I ever have a visible symptom, I will go. Maybe they will listen if they can actually see it. Maybe they will listen when I am older. Maybe they will listen to my husband. Maybe when I die, they will find something on the autopsy. Story 24. I had absolutely no signs. I just found my breast tumor by chance while doing my first breast self-exam in the shower. I was very high and was just looking for an excuse to stay in there a bit longer. Stage 4 breast cancer at 29. Story 25. My sister had some marks on her body, and her doctor told her they were just marks from her lupus. If you have a mark on your body that looks strange, definitely have it biopsied. Story 26. Being a woman who insists everything is going wrong in your body and a doctor tells you that is just women's issues. She was diagnosed after 7 years of begging doctors to check and died soon after. Story 27. The fatigue was overwhelming. I'd get home from work and take a nap. I'm not a nap person, and even then I would still wake up exhausted. I'd do something like scoop the cat litter box and have to lie down. I didn't write for months, and I love to write. I'd forget words in the middle of a sentence. I had to write down processes I did at work every single day because sometimes I would forget what I was doing in the middle of it. I couldn't sit up in my sewing chair long enough to do more than a couple of seams. I thought it was just because of the first 6 months of constant menstrual bleeding that my doctor dismissed for the next year and a half as probably long coronavirus disease. Once my body figured it out, I expected to be fine. I passed out standing up too quickly after a nap and ended up in the emergency room. Then I was ordered to see my gynecologist as soon as possible. It turned out I had endometrial cancer. Story 28. Abdominal pain, weight gain, and bloating. No, not everything can be dismissed as women's issues. Story 29. Back pain, but she did not ignore it. Her doctors did. She died 6 months after her diagnosis with pancreatic cancer. Story 30. Vaginal bleeding outside the expected days of the month. Nerve issues and tingling sensation in one leg that persist for months. Story 31. My daughter's belly had always been disproportionately protruded from before her first birthday onward. Sometimes we could see what looked like faint muscle, likely colon, pressed against her skin. Even at age 2, we learned she already had stage 4 metastatic liver cancer that had likely been developing for 18 months. The most important thing we tell anyone is this: insist that your child's primary care doctor palpate their abdomen during routine checkups, as was normal for over 100 years. There is a new reluctance to do so, and it cost us precious time in diagnosing her illness. Story 32. My mom had constant pain in her side, rib area, and abdomen for 2 years. She was seen several times, had x-rays done, and was repeatedly told she had fog in her side lung area, which was most likely leftover damage from COVID-19, and that she just had gastrointestinal issues related to aging. It took a visit with a nurse practitioner for a checkup to consider the possibility of colon cancer due to her gastrointestinal issues and to order a CT scan prior to a colonoscopy. She actually had ovarian cancer, and the fog was the cancer along the wall of her upper abdomen, while the gastrointestinal issues were cancer wrapped around her intestines and bowel. She was diagnosed with stage 4 ovarian cancer when she could have started treatment 2 years earlier. I wish every day that we had fought harder for a second opinion. Story 33. My aunt had abdominal pain for months, possibly up to a year. She did not take it very seriously at first, even though she could hardly eat and was losing a significant amount of weight. It was eventually diagnosed as pancreatic cancer. Story 34. Never had any symptoms until I found the lump in my breast. It was still stage 3 at diagnosis. I am too young for mammograms. Basically, just bad luck. Story 35. One day I squeezed my right nipple and black fluid came out. Black as ink. It left a black smear on a paper towel. I was very alarmed and went directly to the cancer center. They saw the black fluid and said, "Oh, that's just a type of bacteria that has taken up residence in your milk ducts. Some women just get it. It's unusual but not harmful. Since you are here, let's do a breast exam." They found a tiny tumor in my left breast. It was so small I could not feel it, but the nurse who had done many breast exams said, "Oh, are you busy the rest of the day? We need to run some tests." I caught it early and seemed to be doing okay. That black discharge really scared me. Story 36. If you are having multiple bowel movements a day and none of them are solid, and if many foods cause diarrhea, it is important to see a gastroenterologist. My father experienced this for years, and we urged him to seek medical advice. He finally did last May, was diagnosed with late-stage colon cancer, and passed away less than 3 days later. If your bathroom habits change or you are passing constant, unpleasant gas, it is time to have a colonoscopy. Story 37. At 48 years old, she was a great swimmer, always active and working out. She had the body of a 25-year-old. Every time she came back from working out or swimming, she had a stomach cramp that was slightly bothersome. She would go to the doctor, but they would just tell her to take Tylenol and that it was probably just a muscle cramp. When the pain became severe, she finally had an MRI, which revealed stage 4 ovarian cancer. She passed away quickly 1.5 years later. Rest in peace to my sister. Story 38. Night sweats. I would wake up drenched in sweat, with the sheets and mattress soaked. I thought it was thyroid issues, but they became more frequent over time. Eventually, I was diagnosed with stage 4 Hodgkin's lymphoma. 6 months of chemotherapy, and the oncologist is confident it is cured. 3 more years until it is confirmed cured medically. The fatigue I attributed to working 9 to 12-hour days outside in all weather in construction trades. Story 39. As someone who has experienced cancer, you know your body like no one else. If you notice something different about your body that cannot be explained over a period of time, such as weeks, have your doctor check it out. Unexplained bruising, fatigue, lumps, spots, or bleeding are important signs. Mine was a lump in my breast that was not going away like the others had. I am thankful I listened to my body and my doctor listened to me. Story 40. Fatigue that did not make sense. Not tired, drained. We attributed it to stress until it was far too late. Story 41. My best friend had a freckle on her eye some years ago. Could be nothing or it could turn into cancer, so she was advised to get it checked every few months. She didn't really talk about it, so I kind of forgot, until she casually mentioned that she had lost vision in that eye. I was surprised and suggested she go to the doctor. Again, I forgot about it until she was hospitalized for extreme pain in that eye. Later that day, the doctor said, "Yes, the eye has to be removed. We're doing surgery in 2 days." His bedside manner was harsh. I had never heard of ocular cancer before, but I am familiar with it now. Thankfully, modern medicine caught it early, and it did not spread. She lost one eye but should live as long as me. Get your eyes checked, everyone. And don't be like me, make sure your friends follow up on health issues. Story 42. My husband, age 34, recently passed from brain cancer. A few months before his original diagnosis in mid-2023, he started experiencing severe vertigo and became very anxious while driving. He always needed glasses but never got them, so I assumed his vision was just worsening. He also developed a noticeable foot drag whenever we went out drinking, which was actually quite funny at the time. It was a sign that he was significantly affected. The foot drag was on the side opposite to the location of his brain tumor, which made sense later. It would have been impossible to know he had cancer until the diagnosis, so I do not hold any ill will about that. It was what it was. I obviously miss him terribly, but he experienced a very slow mental deterioration that I would not wish on anyone, nor would I want anyone to endure that with their partner. Story 43. For my father, it was constant fatigue and a persistent cough that would not go away. He kept brushing it off as stress or allergies. By the time he finally went in, it was stage 4 lung cancer. If something feels off for a while, please do not ignore it. Early checks can literally save lives. Story 44. I learned in nursing school about the acronym CAUTION, which is helpful in detecting the early signs of cancer. I lost my father to cancer when I was 16. He was a smoker. I hope all people living with cancer get another chance at life. See change in bowel or bladder habits. A sore that does not heal. U. Unusual bleeding or discharge. T. Thickening or lump in the breast or elsewhere. I. Indigestion or difficulty swallowing. O. Obvious change in a wart or mole. And nagging cough or hoarseness. Story 45. Everyone keeps saying fatigue, but if you suddenly start losing weight without trying, go to a doctor immediately. Story 46. Diagnosed with a brain tumor twice. Both times I did not feel normal. Consistent headaches, forgetfulness, loss of time, balance issues, ringing in the ears, mood swings, 1 minute happy as a clam, the next crying, and extreme fatigue, but not normal fatigue. Simply cutting the grass would put me down for 2 days. The first time, my doctor blamed it on anxiety, then depression, then said, "You were just getting older, try exercising more." This went on for 2 years until I had a spell while grocery shopping where I do not recall walking through an entire department, and finally came to hearing my daughter yelling, "Dad, are you okay?" I went to the doctor the next day and said I was not leaving until we found out what was wrong. One magnetic resonance imaging scan later, we found a tumor at the base of my brain wrapped around the nerves and spinal cord. I had surgery a month later and they removed it all. 2 years later, all of the symptoms came back. I asked for another magnetic resonance imaging scan and we found I had a clival chordoma, which is a super rare bone cancer of the skull and brain. It is so rare they call us the 1 in a million gang because that is the ratio of being diagnosed with a chordoma. I had surgery to remove the tumor, but unfortunately it had entered my dura mater and spine, so it will more than likely spread. Long story short, you know your body and you know when something is off. Do not brush it off and do not let others dismiss it either. Be your own advocate for your health and tell your doctors what you feel you need. If they disagree or gaslight you, find a new doctor. They call it practicing medicine for a reason, and most of the time they are basing your diagnosis on the first search of WebMD or clinical reference that matches most of your symptoms. Story 47. Pain when urinating and or chronic urinary tract infection symptoms, especially over the age of 40. My husband ignored it as it was intermittent. Stage 4 bladder cancer is treatable but not curable. He was diagnosed in the emergency room after a severe blood clot caused by enlarged lymph nodes. Story 48. My dad was always healthy. His back started to hurt and he was tired. We attributed it to age, 68. However, he developed a strange rash and was diagnosed with stage 4 non-Hodgkin lymphoma. I miss you, Pops. Story 49. My friend's husband had a cough and slight chest pain. He went to urgent care for the cough, was then sent to the emergency room for x-rays, and never left the hospital. They found stage 4 lung cancer and a tumor the size of a grapefruit on his lungs. He passed away 10 days after being admitted at 58 years old. Story 50. As many have said, the fatigue. I worked a physically demanding job and just assumed I was getting older. Not the case. Also, the reason they caught my cancer at all was a CT scan for a cough that lasted about 2 months. About a month before I went in for the cough, I was bedridden with pain near my liver and kidney on my back for a day. I ignored it and it went away. Turns out I have advanced cholangiocarcinoma. It is pretty fast and very aggressive. The tumor grew 2 to 3 centimeters in just under 2 weeks between scans. If I had gone a month earlier for pain, fatigue, or even the cough, we might have caught it early enough. Now it's terminal. Don't ignore the signs and advocate for yourself even if the doctors don't want to do anything. The cough was because the tumor was so large it was pressing on my diaphragm, or so they said. Story 51. Not an early sign, but one of my aunts died from cervical cancer. It made me book a Papa Nicolau smear immediately, as I was already a year late. My results came back abnormal, and I had to go through 3 rounds of colposcopies before I was cleared to return to just Papa Nicolau smears. My doctor said if I were not as young as I was at 26, she would have recommended the loop electrosurgical excision procedure. Story 52. My dad smelled off to me 6 months before he died. I cried, and everyone thought I was crazy. He was admitted due to sepsis in December 2022 and was riddled with cancer. He passed away quickly. He was on oxycodone for severe back pain that probably masked other pains. Story 53. Severe headaches occurred randomly over 6 months. Brain fog, confusion, slow speech, and slow thinking were present. He was unable to drive and fell at home. He died within 6 days of glioblastoma, a severe brain cancer. He was my best friend, and I loved him very much. Sometimes there is nothing you can do. I was lucky enough to give him the biggest hug before he passed. Story 54. My toddler showed 0 weight gain between her 2-year-old and 2.5-year-old checkup and had a cold that would not go away. We were extremely lucky a doctor noticed it. They ran a quick complete blood count and had us immediately rushed to the Children's Hospital for a bone marrow biopsy. She was diagnosed with leukemia within 24 hours of a regular checkup. Story 55. My periods were always long, but in my early 40s they started to last longer. Eventually, 2 years ago, they didn't stop. I was bleeding continuously. A few months ago, I began experiencing severe pain in my uterus. My doctor sent me for scans because she suspected fibroids. I also got an appointment to see a gynecologist, but there was a 2-month wait. The bleeding never stopped, and the pain worsened. I eventually had to go to the emergency room because the uterine pain was so intense. They gave me 2 bags of blood because I was anemic from all the bleeding. Meanwhile, the scans suggested I might have adenomyosis, a condition I had never heard of before. I saw the gynecologist and had a biopsy. He said not to worry. Everything on the scans looked fine, but the biopsy was to test for cancer and other issues. We scheduled a hysterectomy to stop the bleeding and pain while trying to preserve my ovaries. During this time, the doctors prescribed me oxycodone, but it did nothing. I was in agony. Over a week later, I received a phone call informing me I had stage 1 uterine cancer. I was referred to an oncologist. Everything was localized in one area, and they believed removing the uterus would remove the cancer, but we discussed chemotherapy. My pain worsened, so they moved up the date of my surgery. I had the surgery, and 2 weeks later, I went for my first post-operative appointment. My doctor said that during the operation, they saw unusual strands and sent them for testing. The test results showed that the cancer had spread beyond the uterus. They believe my heavy bleeding pushed it out. They removed the ovaries because the cancer had spread. My cancer stage was upgraded to 3B. They also found that I had endometriosis. I am healing well from the hysterectomy, but I am now awaiting my second chemotherapy treatment and am on day 5 of radiation. I am very angry at myself for not going to the doctor immediately. It had gotten to the point where I wasn't even thinking it was odd to have a continuous period. I was just annoyed. As I sit here, sick, weak, and worrying over bills, I really wish I had gone to the doctor sooner. Story 56. Hip pain. The doctors said my mother needed a hip replacement. Turned out to be cancer. Within a year, she had passed away. Story 57. Unexplained random weight loss, changes in bowel movement frequency, and skin that appears different or unusual, such as orange peel texture on the breasts. Story 58. Anyone over 30 should have a dermatologist, urologist, and primary care physician. Colonoscopies should begin at 35 instead of 50, and prostate exams should be done every year. Odd pains that linger should not be ignored. I lost my father to a strange leg pain. It turned out he had a large tumor just above his kidney in the fatty tissue, pressing on a nerve. He was diagnosed in November and died in July. A friend at work experienced frequent foul gas. He used to laugh it off, but it turned out to be colorectal cancer. He died 3 months after being diagnosed. Story 59. I got lucky and it was only precancerous. However, ladies, if you notice discoloration around your nipple that resembles a bruise but does not hurt, get it checked. Story 60. I had a really special atypical colorectal cancer that does not usually present with symptoms and is almost always found incidentally through routine procedures. When I say special, I mean 3 to 5 cases per 100,000 cases. I had diverticulitis at age 40, and they gave me a colonoscopy where they found the cancer. Had I not gotten diverticulitis so bad that I ended up in the hospital, that tumor would have grown for another 4 years before my first colonoscopy found it, which likely would have led to a very different prognosis. Story 61. My dad's primary care physician and urologist kept telling him he had an infection despite having very high prostate-specific antigen numbers for years. It turns out he has stage 4 prostate cancer, and they simply did not request a biopsy or consider it a problem. Meanwhile, we did not catch it until it had spread to his bones and he had tumors pressing on his spinal cord. He has had many related complications since. Incompetent doctors are going to be the reason he dies before he should. Also, my younger sister had a bump on her leg next to her knee that she noticed when she was 20. It hurt and she had trouble walking. She went to the primary care physician and was just told to use ice and an elastic bandage. A month later, she went to a specialist and was diagnosed with osteosarcoma. She underwent chemotherapy, surgery, more chemotherapy, lung surgeries, and amputation, and the cancer still took my sister from me when she was 23. Cancer is devastating. Story 62. My cousin had been exhausted for a while, and she thought she was merely overwhelmed or overworked due to being a first-time parent and working part-time in kindergarten with small children. She had leukemia. She had a positive attitude, and we were all hopeful about the outcome since she had received a bone marrow transplant and was no longer undergoing chemotherapy. Sadly, her organs were shutting down, and as the doctors had put her into a coma, she was no longer capable of breathing on her own without a machine. We still do not fully understand why she became so sick. It has been over a year, and we still miss her deeply. I love her. I will always love her. Story 63. This has less to do with my family than my pediatrician. I had swollen lymph nodes. I was told that it was really common for children and teenagers to have swollen lymph nodes and that they would eventually go away. A year and a half later, we finally convinced a nurse to perform a biopsy, and it was cancer. I had my thyroid removed the summer after my freshman year of high school. Story 64. Urinary tract infection. If you get diagnosed with more than 3 or 4 in a year, just go get your kidneys checked to be safe. I was told I had urinary tract infections, but it was actually kidney cancer undiagnosed for 2 years. I was 35 when I found out. They kept telling me I was too young. Advocating for yourself is so important. Story 65. My dog used to sit with one leg held up. My parents and I thought he was doing it for attention. It was not until he was limping that we took him to the veterinarian. He had cancer in that leg, and by the time we took him in, it had spread. He was a Chihuahua, and given how much cancer was in his body, the veterinarian said it would likely be fatal. So we had him put down. Rest in peace, Ozzy. I will always remember you, brother. Story 66. My baby was diagnosed with cancer before he turned 1. He cried all the time and was diagnosed with colic by 3 separate pediatricians. Colic is a symptom of something else. Get lab tests done, ultrasounds, everything. Story 67. My problem is the opposite. I do not ignore anything, but the doctors downplay everything. It took me 15 years of complaining about period pain to get diagnosed with stage 4 endometriosis. I suspect my next surprise diagnosis will be cancer. One specialist told me he thought there was cancer on a scan. The surgeon who took my uterus said the world-class pathologist said there was not. The initial specialist then argued that they had not done pathology on the correct part of the uterus. The surgeon then simply said the other doctor was wrong. My general practitioner did not seem to care when I raised any of this with them. Oh well. Story 68. If you were diagnosed with diabetes with no family history, and diet, exercise, weight loss, oral medication, and even insulin do not lower your hemoglobin A1C, please have your pancreas checked. Pancreatic cancer is a silent killer. Story 69. My grandfather worked for the city parks department in the summer. He never wore sunscreen. He would get lesions on his skin. He didn't like going to the doctor, so he did what some might do and cut out the lesions with his pocket knife, then treated the wound by applying Old Spice aftershave. His skin cancer worsened, and he finally went to the doctor where he had to undergo multiple skin grafts. He also smoked heavily. He was placed in hospice care for skin and lung cancer and passed away a month later. The moral of the story is to wear sunscreen and avoid smoking. Story 70. If you have frequent headaches and poor memory, it could be a brain tumor. If you have frequent but small bowel movements, it could be intestinal cancer. If your eyes are yellow, it could be liver cancer. If you have random moles, it could be skin cancer. If you are constantly tired, it could be blood cancer. Story 71. Bruising. My aunt did not recognize how easily she was bruising and how many bruises she had. One day, she became very lightheaded and passed out at home. They rushed her to the emergency room, and a few hours later, I received a call from my mother saying she was on life support. Another hour later, I was informed that she had died. Her leukemia was undiagnosed and so advanced that it had spread throughout her body. Story 72. Bruising and back pain in a 3-year-old. We were told our daughter's bruises on her legs were normal kid bruises, and her back pain was probably just being an active toddler who had a minor fall. It was not normal. It was leukemia growing in her spine, damaging her spleen and her body's ability to make blood. Her bone marrow was 96% leukemia cells when she was finally diagnosed. Story 73. One of my sister's early symptoms was a proliferation of seborrheic keratosis all over her body. There were other symptoms like vomiting and nausea at that point, which were attributed to gastroesophageal reflux disease. By the time they found the origin as esophageal cancer, it was stage 4, and she only had a couple of months to live. She died at 51 with not a single gray hair and looked like she was 25. Sometimes you don't see it, and sometimes it presents very subtle changes in the early stages that get attributed to other diseases. Not everybody dies looking gray and slowly withering. Story 74. Not cancer, but at age 15, my father decided to get me laser-assisted in situ keratomileusis for my 16th birthday. They did a pre-check before surgery and realized both retinas were torn or detached. And yes, there were no symptoms. Please get your eyes checked regularly. I would have been blind in both eyes by 16. Story 75. If the testicle feels firm, get it checked. Your testicle should be soft and squishy like a grape. Do not stab your testicle with a fork. Thank you. Story 76. Pelvic pain. A very close friend of mine kept thinking she had uterine fibroids. It was uterine sarcoma with metastases to the brain. She died 90 days after her diagnosis. It is not normal to have severe pain. Get it checked. Story 77. I had absolutely no symptoms. The doctor couldn't even feel it in my breast. A routine mammogram detected it. I don't drink alcohol. I have never smoked. I eat very little red meat. I am very active at the gym. I breastfed both of my children. If it is going to happen, it is going to happen. The same goes for my friend. He had no symptoms but went to the doctor because a small lump had formed on his neck. Long story short, he was diagnosed with stage 4 lung cancer and has been given 18 months. Story 78. My fiancé has brain cancer. He was vomiting and having headaches, but not typical headaches. He experienced personality changes, could only lie on one side, and was seeing things. I kept trying to get him to a doctor, saying, "You're too young to be this sick all the time." He only went to the hospital when he lost his vision. It all seems obvious now, but brain cancer is insidious and hides itself well as other normal conditions like migraines. Story 79. My late father had esophageal carcinoma. The symptom he said he wished he had seen a doctor for was extreme acid reflux. He had taken large amounts of antacid tablets for it. Story 80. For me, I had a checkup back in November 2020 with a migraine doctor. She noticed that my thyroid was a bit enlarged on the left side and wanted another migraine doctor to check it out too. He never came in, so we did not think much of it further. 2 years later, I noticed a lump just next to my throat that moved every so often when I swallowed. It was noticeable every once in a while, but I brushed it off. It is now July, and I am noticing a swollen lymph node on the side of my neck. I attributed it to being sick the week prior. It did not go away. I got it checked out and received medication, but it did not go away. I received more medication, same story. Third round of medication, no change. I waited for finals to be done and then went back to the doctor. It had not changed much. He sent me to get imaging done. It was all over the left half of my neck and strongly suggested thyroid cancer. I was referred to an ear, nose, and throat specialist. It was now January 2023. I was almost 24 and preparing for surgery. Surgery happened, and I went home on my birthday back to my husband. We celebrated as best we could. In June, I received radiation, a single pill full of iodine that is highly radioactive. It is not ideal, but I became a science experiment for the physics department for a full month. Jump to the present day, I have completed a 1-year scan. Came back clean. I am taking replacement hormone medication for the rest of my life. I will be monitored for this cancer for the rest of my life as well, with 5 years of yearly checks and then checks every 3 years after that. 1 year down, 70 to go, I hope. Story 81. Stomach cancer is an extremely aggressive disease. Common symptoms include acidity, nausea, and bloating, which people often experience regularly. It is often diagnosed accidentally or at the 4th stage. It is recommended that people screen themselves every year from the age of 35 for any form of cancer. Also, get a comprehensive gene panel test, also known as somatic testing, done once on a family member who has cancer. This test warns their children about possible DNA mutations that could lead to cancer. It saves a lot of time. Story 82. I was experiencing a strange leg pain that developed into nerve pain, eventually causing me to lose the ability to walk or touch my leg without discomfort. I was also losing weight. I was shocked when I found out it was cancer all along. I still live with the fear that the tumors might come back someday, and it is terrifying to me, so I try not to think about it. Story 83. My husband had a persistent cough that made me very anxious. Then he became short of breath. He got sick with what seemed to be a respiratory virus. He looked terrible, was losing weight, and lost his appetite. I finally convinced him to go to the doctor. They gave him antibiotics. 2 weeks later, he was worse, so they sent him for a chest X-ray. It showed a large lung tumor. He died less than 3 weeks later. This happened 2 years ago. I know I could not have done anything differently, but I am still angry about it all. I wish I had pushed him harder to get seen and have an X-ray sooner. I am still heartbroken. He did not have to die. Story 84. With my mother, it was the night sweats. She was shrugging it off, thinking it was just symptoms of menopause. We found out later she had leukemia, and it was quite advanced by then. We lost her 6 months after she was diagnosed. Story 85. I had a recurring sore throat for years that never seemed to produce any other symptoms. I just felt weak and my throat hurt. Came and went for years. I noticed a bulge in my neck. I had it checked, and the doctors could feel it but said it was probably nothing. Over the years, different doctors with no knowledge of it would pause during regular examinations and then just shrug. Fatigue gradually became more severe year after year. I thought I was just getting older. Every once in a while, I started waking up covered in sweat, so much that I was dehydrated when I woke up. My ears began filling with fluid to the point where I couldn't hear out of my right ear. Hair thinning led to a noticeable bald spot. I also started feeling a strange pain in my collarbone. I went to a new doctor who thought it was probably nothing but agreed to do an X-ray if I was worried. It turned out to be several malignant tumors in my thyroid. One was 5 times the size at which doctors recommend removing part of the thyroid, even if the tumor isn't malignant. I had a total thyroidectomy. There was no spread, and I am doing fine now. I am only alive because it was slow growing. I wouldn't be here if it had been the more aggressive type. Pay attention to your body and take care of yourself. I always tried to power through everything, but my body was practically throwing road flares at me. If you're concerned, feel something isn't right, or feel you are getting the runaround, keep at it. Get multiple opinions. Story 86. I had fatigue. I would have to take naps after workouts. I knew something was wrong. I used to be a machine, but now I had to sit down after doing anything. I wasn't sleeping all the time, but just didn't have the energy to do my normal routines. My mood changed. I wasn't enjoying things I usually enjoyed. I chalked it up to being a new mom. I found a lump and thought it was from breastfeeding. It was stage 2 breast cancer at 33. I tell everyone I know to get an ultrasound or mammogram as young as they can. Story 87. My mom worked in a hospital ironically and thought she was just having full body pain resulting from stress. Turned out she had cancer. Doctors gave her 1.5 years to live, but she fought for 4 years. Love you, Mom. Story 88. My 2-year-old son completely lost his balance, and the doctor said it was an ear infection. I told them I did not see children falling over all the time due to ear infections. When he started projectile vomiting, I told the emergency department I thought he had a brain tumor. They told me there were many things to rule out before they could confirm that. 2 days later, they confirmed it was a brain tumor. He is okay now, 8 years later, following surgery, chemotherapy, and radiation. Story 89. Dad had a plantar wart an inch deep that was not responding to treatment. The doctor thought it warranted blood tests. After many tests, it turned out he had a very rare form of leukemia. Thankfully, it was treatable. Story 90. My cousin had a slightly enlarged knee. The doctor did not scan anything and just thought it was fluid. He prescribed hormone medication. It turned out to be bone cancer, and the medication caused it to grow faster. Once it was discovered, it was basically too late. My cousin died at 18. Always request a scan. Story 91. It ended well, but I always try to spread the word. My wife had a small amount of liquid ooze from her breast after an otherwise perfect breast exam. It was cancer that had already begun to spread to her arm. Even knowing it was there, her physician did not find it by palpation. She ended up beating it after 18 months of treatment. Story 92. My grandmother had horrible pain in her tailbone area for years. She saw many doctors who kept trying to diagnose it as shingles, even though she was missing some typical characteristics of shingles. She also experienced randomly passing out and sometimes struggling to defecate. She dealt with these issues for about 15 years with no answer. One day she passed out at work and was rushed to the emergency room. They conducted exams and found growths in her colon. They tested them, and they were cancerous, which was the cause of the pain she thought was in her tailbone. The cancer was quite advanced, but I do not remember the exact stage. She underwent chemotherapy and is doing well now, but I wish her doctors had done colonoscopies and exams years earlier. Story 93. My best friend's mother started acting differently, almost aggressively, and just not like herself. For about 1.5 years, my friend was unsure how to handle her mother's new behavior. She crashed her car in a parking lot, and they found a brain tumor. Story 94. My best friend decided to get in shape. He started working out and eating better. He went from 350 pounds down to 250 in a year, but complained about pain after moving a lot in the gym. We all thought he had muscle pain since he worked hard at every session, fully motivated to improve his fitness. It turned out he had cancer in almost every organ. I still remember the conversations with him about it. I thought it was odd to have so much chest and abdominal pain after working out, but not in the arms or legs. I wish I had given more thought to what he was saying and thought critically. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.